Hello everyone, good day, and welcome to our channel. Today we are going to have insight on bird flu. It is scientifically known as avian influenza and a viral infection primarily affecting birds, though certain strains have the potential to infect humans and other mammals as well. It represents a significant public health concern due to its potential to cause severe illness and death in both avian and human populations. Avian influenza is caused by influenza A viruses, which naturally circulate among wild birds, particularly waterfowl such as ducks and geese. These viruses are classified into subtypes based on two surface proteins, hemagglutinin, H, and neuraminidase, N. To date, 16 H subtypes and 9 N subtypes have been identified, giving rise to various avian influenza virus strains. While avian influenza viruses typically cause asymptomatic or mild infections in their natural bird hosts, they can lead to severe outbreaks in domestic poultry, including chickens and turkeys. In such cases, the virus can spread rapidly among flocks, causing high mortality rates and significant economic losses for the poultry industry. Although avian influenza viruses primarily infect birds, certain strains have the ability to infect humans, resulting in what is commonly referred to as bird flu in humans. Human infections usually occur through direct or indirect contact with infected birds or their environments. This can include handling sick birds, exposure to contaminated surfaces or objects, or consumption of undercooked poultry products. While human infections with avian influenza viruses are relatively rare, they can have serious consequences. Some strains, such as H5N1 and H7N9, have been associated with severe respiratory illness and have caused sporadic outbreaks in humans, often with high mortality rates. Additionally, there is concern that avian influenza viruses could undergo genetic mutations or reassortment events, leading to the emergence of novel strains with increased transmissibility and pandemic potential. The symptoms of avian influenza in humans can vary depending on the specific strain of the virus and the individual's immune response. Common symptoms include fever, cough, sore throat, muscle aches, headache, and difficulty breathing. In severe cases, the infection can progress rapidly to pneumonia, acute respiratory distress syndrome, ARDS, organ failure, and death. In birds, avian influenza can manifest with a wide range of clinical signs, including respiratory distress, decreased egg production, diarrhea, neurological symptoms, and sudden death. The severity of symptoms often depends on the strain of the virus, the age and species of the bird, and environmental factors such as stress and co-infections. At this stage, we have certain information on bird flu. The next stage is to know about its prevention and control measures. Preventing and controlling avian influenza outbreaks requires a coordinated effort involving public health authorities, veterinary services, poultry producers, and other stakeholders. Key strategies include surveillance, monitoring wild bird populations, domestic poultry flocks, and human cases to detect and track the spread of avian influenza viruses. Biosecurity, implementing strict biosecurity measures on poultry farms and in live bird markets to prevent the introduction and spread of the virus. Vaccination, utilizing vaccines to protect poultry against specific strains of avian influenza and reduce the risk of transmission to humans. Education and awareness, providing education and training to poultry producers, healthcare workers, and the general public about the risks of avian influenza and preventive measures. International collaboration, facilitating information sharing, laboratory cooperation, and coordinated responses to avian influenza outbreaks at the regional and global levels. Prevention measures required to reduce risk of bird flu in human. Wear protective clothing and wash your hands frequently when handling birds, wild animals, and livestock. Don't work with animals that have been exposed to avian influenza. Take your shoes off before entering your home after being in areas where birds like waterfowl or chickens live. This reduces the risk of spreading bird droppings or anything else that could be contaminated with the virus around your house. Lastly, if any human is affected with this virus, even after taking all the necessary measures, treatment options are going to be considered. The treatment of avian influenza primarily involves antiviral medications such as oseltamivir, Tamiflu, or zanamivir, Relenza. These drugs work by inhibiting the replication of the influenza virus, thereby reducing the severity and duration of symptoms. However, their effectiveness depends on early initiation of treatment, ideally within 48 hours of symptom onset. In severe cases requiring hospitalization, supportive care such as oxygen therapy and mechanical ventilation may be necessary to manage complications like pneumonia and respiratory distress. Overall, avian influenza represents a complex and evolving public health challenge, requiring ongoing vigilance, research, and preparedness to effectively control and mitigate its impact on both animal and human health. If you liked the video, please subscribe the channel to stay tuned.